I wanted to bring today's episode to the podcast talking about chronic pain. And this is something that we may not think is related to our fertility. But in the functional approach to fertility, we look at the whole person, the whole body, and really looking at those stressors, be it a gut infection, food sensitivity, environmental toxins, mental emotional stressors, and a structural stressor. So if you've got back pain, knee pain, neck pain, sciatica, pain in your body, that's causing inflammation and stress on your body. So we talk about really what you can do right now to address that and really why this is important when you're on the fertility journey. So thanks so much for listening. Hey there. Thanks so much for listening to the Get Pregnant Naturally podcast. And I've got a favor to ask you. If you are enjoying learning about the functional approach to fertility, consider going to iTunes and rating and reviewing the podcast. This is how it helps the show reach more people that are struggling with infertility, knowing that there's another approach that really can get to the bottom of why it's not working in the first place. So all you need to do is, if you're on the app or the desktop, just go in and consider leaving a 5-star rating and leave a review. And there is step-by-step instructions in the show notes showing you exactly how to do that. So if you can just take a few minutes, just take the few minutes right now. You can pause this recording, come back, leave the review. It would really mean the world to me and help others that are on the fertility journey as well. Take care. Hey there. I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery call is for action takers. And really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to Fab Fertile, F-A-B, fertile.com and click on book a free call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's Fab Fertile, F-A-B, fertile.com and click on book a free call. One theme that keeps coming up with the couples in our Fab Fertile Couples Coaching Program is sleep. Whether it's insomnia, having a hard time falling asleep, waking up at night, or feeling tired when we wake up, sleep is critical for fertility and hormones. And that's why I'm so excited to have Blue Blocks as our podcast sponsor. So we're exposed to blue and green light from our phones, our tablets, our computers, indoor lights, and more. And this exposure impacts our melatonin production. And melatonin is essential for both female and male fertility. It helps determine the frequency and duration of our cycle and impacts sperm. There's lots of blue light blocking glasses on the market, but the ones from Blue Blocks, they've actually compared other popular brands, and Blue Blocks block 100% of blue and green light while other brands fall short. So I have their sleep glasses. They have red lenses, and the ones I have are a little translucent frame, and they're so stylish and really cool. And so they eliminate 100% of the blue and green light in the 400 nanometer to 550 nanometer range. So this is exact range that has been shown in clinical studies to disrupt melatonin and negatively impact your sleep. So all you do is wear your sleep glasses after sunset until it's time for bed, and you'll notice improved sleep after just one use. And it's also cool to use when you're flying for managing jet lag. So I got to say I was a little skeptical about the noticing improvement after one use, but literally I use these glasses and my sleep is actually already pretty good. I used them for one day, and I have to say after one day, I had the best sleep of my life. I just felt so rested. So these glasses, they ship free and they're tracked for all orders anywhere in the world. And also they have all their frames come in prescription, non-prescription, and reading glasses. Plus you can send in your frames and they'll add the blue light blocking and green light blocking lenses to your frame. So this is an easy hack that you can add to your fertility toolkit. All you do is go to Blue Blocks, BLUBLOX.com. Use the coupon code GetPregnantPodcast at checkout and receive a 15% discount. That's Blue Blocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast to receive your 15% discount. I didn't need to go to donor eggs. Obviously, I don't regret it. I have beautiful children. I could have done things differently, restored. I was still cycling back in my 20s. I could have looked at my health, the environmental toxins, the stress I was under.
Many women are being told their eggs are too old. That's often merely an assumption that's not based on actual evidence. The reason being that there is no direct test of egg quality. You can't test egg quality.
It's the man who's got a food sensitivity or he has a zinc deficiency.
Like there can be a root cause to these symptoms that are, quote unquote, period problems, that the doctor will pass you a pill without any question of why.
And some part of you knows that if you can reframe your journey from not want to struggle, or if it is struggle, learn how to embrace the struggle. Learn how to embrace it.
Most conditions in the child occur during the 9 months of development. It's the genetic switches are turned on or turned off, and they're pre-programmed. So you are in such a powerful, amazing position to do amazing things for your kids.
Why is IVF the first step? Because we believe it should be the last step. Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey everyone, I'm Sarah Clark, the founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today I'm welcoming Alison McLean to the podcast, and we're digging into chronic pain and how that can impact your fertility. Alison McLean is a physical therapist, yoga therapist, and massage therapist, and the founder of Ignite Wellness. She specializes with helping people with chronic pain. So thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Alison, excited to have you on the podcast.
I'm so glad to be here. Thank you so much.
Yeah, awesome. If you could share your journey and really how you came to do this work.
The combination of yoga and physical therapy came about for me, and massage was just through my own injuries and my own experiences. I had a few surgeries in my life, and I found the best way to heal fully was the combination of physical therapy and traditional Western medicines, as well as lifestyle, mindset, and essentially the yoga philosophy as well.
Great. Did you have back issues? I can't remember.
Well, some of my yoga students laugh because they say I live many lives before I turn 40. So I have experienced a lot. Everything from 3 wrist surgeries when I was 19 years old. I was a Division I diver in college, and I hit the diving board really hard with my hand. That was a very grueling and injury. And that's what first got me into yoga. And at that time, I thought I was invincible, which I think sometimes when you're 19 or 20 years old, you just do. And I tried to come back from that injury too soon and end up dislocating my shoulder, which then resulted in a shoulder surgery. Yeah, I healed from both of those through practicing yoga, physical therapy, and massage. And eventually, when I was a practicing PT, I ended up with a back injury. I have a mild scoliosis, which I didn't even know at the time, but it led to pressure on my discs and my nerves, which resulted in a disc bulge and nerve pain down the leg. At the time, for a good week and a half, I was pretty laid up and really had to limit my activities. But I came back from that, using all these techniques, and had a cesarean surgery, came back from that. And most recently, I had colon cancer and a resulting colon surgery. And again, a lot of these tips, techniques, I practice into my own life. So I'm back practicing and now using most of these tips and techniques to manage my own stress, since I found out I have a genetic mutation called Lynch syndrome. Just knowing that you're a higher risk for cancer, along with, I find being tested, the screens are invaluable, the cancer screens, because that's what caught my cancer early in the first place. So I am so grateful for those tests. However, when you're going into the doctor's office every 3 months or so to do some type of cancer screen, it can be very triggering and lead you down that worry and doomsday kind of mindset. So I do use a lot of the practices in my own life day to day to just stay hopeful and positive.
Wow. Okay. So that is a lot you've been through. Yes. Like many of the guests that I have on here, usually it's like you come to this work because you work on yourself first.
Yes.
Yeah. So I wanted to bring this episode talking about chronic pain and really how that impacts our hormones and fertility. Obviously here we take a functional approach, looking at the stressors in the body, be it a food sensitivity, a gut infection, environmental toxins, the mental emotional stressors. and a structural stress. So if you've got chronic pain that you're dealing with, how does that then impact your hormones and fertility? And if you could share with us a little bit about that.
It's multifaceted. So with chronic pain, research is showing that there's changes in the brain. So even that how our brain, which centers are lighting up or not lighting up, or pain pathways, nervous system pathways, so messages from the body to the brain and back are all changed with chronic pain that's been going on a long time, which then can influence how the body, how the mind interprets feelings of safety versus feelings of danger. Because pain in the body is a message that at the time something can be injured. There might be a danger and a scenario, something might need to be taken care of. However, when chronic pain goes on for a long time, typically there isn't a structure or a tissue being injured in that moment. However, it's in a way replaying the scenario of an injury, which then can change what hormones are secreted, which central nervous system is functioning more than the others. Is the fight or flight system ramped up, for example, and the rest and digest dialed down? So all this can really influence how, for example, our ovaries are being taxed or not being taxed, and how much estrogen is being produced, or cortisol, for example. All this has to do with coming back to the primary scenario of what's your baseline status.
Yeah. So even though you may have this diagnosis, infertility, whether it's PCOS or endometriosis or low ovarian reserve or unexplained infertility, if there's chronic pain going on, that needs to be addressed as well, because it's not just myopically focusing on the diagnosis, is looking at the whole body. So in this case, if this has been going on for a while, so what are some top mistakes that you typically see with chronic pain treatments?
I think it's just lack of awareness and education. So first off, in Western medicine, what I see with a lot of my chronic pain patients is that they're just a number. They're just kind of shuffled through the system and given pain medicine or a shot first right off the bat. And that's the only solution. Get an injection or try these prescription medications and come back and see us in a few weeks, and we'll reevaluate, if they need to be tweaked or whatnot. And sometimes even that can affect fertility, just because it's a chemical substance in the body. Now, sometimes, however, I'm not saying all pharmaceuticals or all Western medicine interventions are bad. No. That's not it at all. There's definitely a time and place for them. It's just that in a lot of the scenarios for chronic pain, it's just overused, and it's the only solution. Where if you're taking a holistic approach and focusing on, okay, what are the triggers? What are the stressors that exacerbate this chronic pain? And beginning to work with those in maybe conjunction with Western medicine, or as an alternative, and we're reducing stress and even how one might view their own body, their own thought, for example, about their body. Because I think sometimes with chronic pain scenarios, one might consider themselves as broken, or something's not right with them, or maybe they can't be fixed, that type of thing. And that mindset can be a self-fulfilling prophecy in a way, because that can create more stress. More stress exacerbates pain. And then we're in that fight or flight response with increased cortisol, increased taxation on the ovaries, and that sort of thing.
And so sort of the mistakes you're seeing are they're just focusing on medication and injections and then not looking at the rest of the body.
The big picture. Even mindset, lifestyle, diet, support systems, community, all these factors, even someone's financial situation, which has nothing to do with orthopedic structures or medicine at all. But if they're very stressed about their finances, that can exacerbate pain. So in reality, I find you really have to sit someone down and take a look at their whole entire life and how they're living day to day and how they feel about all this day to day.
So let's go through the top types of pain and what you're seeing. So if we start with back pain, which is, I'm assuming that's the most common, is that correct?
Sure.
So what are you seeing there, and maybe talk about that for us?
Sure. I mean, back pain can be very much related to fertility. Some people don't realize that pelvic floor issues. So whether, and this can be for male or female, but let's focus on female for a moment. That if a woman has, for example, a hypertonic pelvic floor, meaning there's a lot of, that's where she holds her tension. So there could be a lot of constrictions, pain with intimacy there, maybe just pain that radiates to the low back. Sometimes pelvic floor issues present as a low back issue. In this scenario, then you need to work with these tight muscles. And again, stress can contribute to these tight muscles. And often another mistake is going right to Kegel exercises, right?
Yeah.
A lot of times pelvic, and sometimes those are appropriate. However, a lot of times, especially with a hypertonic pelvic floor, meaning the muscles are tight, that's just going to contribute to more tightness. So then you have the other scenario of a hypotonic pelvic floor where the muscles are actually loose, and that individual might be at risk for a prolapse, right? And so then there's a lot of pressure on the organs, again, that which can affect fertility and radiate into the back. So sometimes a low back issue is, and often I find this is typically the case, that whether it is a disc problem or a stenosis or any kind of low back issue, degenerative joint disease, yes, the problem might be there in the low back. The diagnosis is of the low back. You actually physically see a disc bulge or a lack of space or a nerve root being compressed. However, the true source or the root of the problem is actually located somewhere else. For example, does that individual have an issue with their pelvic floor? Are their hips overstretched and weak? Or are they very, very tight and they can only move in their body when they bend forward through the low back? So the low back is wearing out, for example. Or are their shoulders tight? So when they reach overhead to get something out of the cabinet, their low back is compressed. So, and the funny thing about low back is it's so common that people consider it normal, a normal part of aging.
Ooh, back pain. Yeah, exactly.
And back pain is not normal. It's a sign that something is going on. There's many people that live their whole lives without back pain. So it is a message from your body to say, something's going on. Something may be tight, something may be weak, something may be compressed. And then, my job is to help figure out what that is and then create a protocol to work with that, whether it be coming from the pelvic floor or their hips, for example.
So commonly, what percentage of the time would you say it's the pelvic floor for back pain?
For me, that's a really good question that I don't have a good answer to. Because it really depends on who your patient focus is. Mm-hmm. So I have physical therapist friends, colleagues that specialize in the pelvic floor. Right. So they would probably say, 85, 90% of my cases, the back issues from pelvic floor, because that's mostly what they treat. Mm-hmm. Me, I treat more general orthopedic issues or systemic problems or lifestyle issues. I'm more of a big picture problem solver. And so my percentage is lower. But for my female patients with low back pain, if they're moms, meaning they had a child at some point in their lives, I do always ask about the birth history because a lot of times cesareans aren't treated following scar tissue mobilization, or their core isn't functioning efficiently following the surgery, even if it was like a decade ago. I've worked with many moms where their kids are in their 20s or even early 30s, and or if there was significant tearing during birth. So most of my moms, I will address the pelvic floor in some way, just because that's just another scenario going on in our Western medicine right now, where a mom has a baby or a cesarean and there's very little follow-up.
Right. And we did an episode, pelvic floor and fertility. So definitely go and check that one out on the podcast to go into detail all about the pelvic floor and why that's so important. Okay. So for back pain, pelvic floor, and then just to recap for us, where else are you looking?
For the back pain?
Yes.
I can look in the hips. Right. Yeah.
Shoulders.
The shoulders, the mid back sometimes is often very stiff. So if the body can't move through the mid back, then the force has to go somewhere. So sometimes it can translate to the low back. So I use this analogy a lot of the time as the low back being almost like a credit card. So if you imagine a credit card and you're always bending that credit card in half in one place, because that's, if you keep bending there, it gets easier to bend there. And then eventually that one bending hinge point wears out. The same is true with the low back. If your hips are tight, you can't bend through there. The mid back's tight, you can't bend through there or twist through there. Then the force is always directed to the low back, and it's the low back that wears out over time.
So let's go on to the knee. See so many people with knee issues.
So knee is another one where often the problem at the knee is not a problem of the knee. So the pain might be in the knee, but I always look below. So starting at the feet and above. So hip strength is huge with the knee. The arch of the foot, whether it might be over supinated or over pronated flat foot or over arched foot, how the force translates up to the knee because of the foot, range of motion, mobility of the ankle can impact the knee, flexibility of the quad, the front of the thigh can really impact the knee. Even bone structures can impact the knee.
Yeah. So hips, arch of the foot, that's interesting. And then, the quads. I remember years ago, like 20 years ago, I had my foot up on a banister talking on the phone, and my brother gave me a karate chop, and then my patella went out. I'm like, oh my God, I'll never walk again. But then after having some laughing gas, it shipped away. It went back in, and it happened to me like 2 or 3 times after that, where it just kind of slipped out. And so working on quad strength. But yeah, ever since then, I'm like, nobody, even when I have a massage, I'm like, I do not allow anyone to touch my knees, just because I'm like, I have some knee fear. But yeah, there's a lot of and a lot of people do have knee surgeries. That's quite common. So yeah, if there's pain going on the knee, as you're saying, you're looking up and down. Anything else there you wanted to?
Yeah, I mean, sometimes the issue is directly to the knee. There might have been some trauma or a fall where there might be a meniscus tear. Those type of surgeries usually do very well because there was a specific mechanism of injury that led to that tear. So the surgery fixes the tear and that person goes on with their life. However, I do find even in those scenarios, getting as much strength and as much hip mobility and ankle mobility as possible going into the surgery can help the rehab after the surgery, and working those areas after the surgery as well just prevents future injuries. But what I treat a lot of in terms of the knee is a lot of yoga teachers and yogi practitioners who are again, it's that force reaction, which is a physics concept. They're trying to, for example, sit cross-legged or do these various postures, and their hips just don't have the mobility for it, whether it be flexibility of the muscles or actually just how their hip bones, the acetabulum, the hip sockets actually shaped or angled can affect how much mobility is there in terms of yoga postures. But yet they're forcing, for example, lotus pose day after day. And because the hip can't go any further, the force travels down to the knee. I've worked with many yogis with meniscal tears because of lack of flexibility or mobility or strength. So then their knee is compromised in various postures because of all this forcing in yoga. But it doesn't make yoga bad, right? It's just how we practice.
The forcing a part of it. Yeah.
Yeah.
Yeah. My husband had a knee thing where he was in Lake Louise and he's like, oh, it's the most beautiful day ever here. I'm just going down the hill right now. And then I get a little call later. Oh, they're just airlifting me off right now.
Oh, no.
My ski, he had some rentals. It didn't disengage. And the ski went one way, the knee went the other, the foot went the other, the leg went the other. And he tore the whole entire knee, and he had really strong leg muscles from years of soccer. But anyways, he had to have surgery and took a while to get back, and then months of physiotherapy, but now he's good. But yeah, so definitely know firsthand the knee issues. And what about sciatica?
Oh, that's a big one.
Yeah.
That's a huge one. I work a lot with sciatica in the clinic, and I personally had sciatica myself, and the nerves are very tricky and irritable structures, meaning once they get angry, it does take a bit for them to calm down and heal. But it's not to say that they won't. Like, for example, with my own back injury and sciatica, it took 1.5 years to heal. Now, it didn't mean that I wasn't practicing yoga for that whole entire 1.5 years, but there was definitely progressions from when I was first injured and not practicing at all to slowly returning back to practice with therapeutic. Most of the practice was lying on my back on the ground, for example, to now my practice is full and I have no limitations. But I find a lot of the times with patients is that they get so frustrated somewhere along the journey that they start to feel better. So then they return to activity too quick, or they push themselves too much and they flare themselves up. And it's this oscillating, feel better, do too much, have a backslide. And so you just really have to be conservative when working and healing with the nerve. I find a lot of the times fascia work to free up the nerve from the fascia of the neighboring muscles. In the back of the legs, for example, the nerve often gets stuck to the hamstrings. So when you're bending forward, it's always getting yanked and pulled. It is very helpful, as well as just gentle mobility. And stress reduction is huge as well, because a lot of times people really worry that it's, just going downhill from there, that they're never going to get better, they're going to have to live with this issue forever, all that sort of stuff.
And just give a brief overview of what sciatica is.
Oh, sure. So sciatica is kind of a garbage term for any pain through the back of the hips, the back of the leg. True sciatica is 2 nerves that exit the spine that come together to form the sciatic nerve, which travels in the back of the hip, right next to a muscle called the piriformis, and then down the back of the leg. So it's kind of right embedded there in between your hamstrings. And then below the knee, it splits again. So you can experience anything from kind of an aching, burning right at the nerve root, right in the low back, or some people feel it in their PSIS area or sacral area. Some people feel it in the back of their hips. Pain or burning. Some people feel more of a numbness, tingling in their feet. So right now, it's just kind of labeled as any kind of nerve symptom coming in the back of the leg or the back of the hip.
Got it. And what about the neck?
Yeah, so you can have radicular symptoms or nerve symptoms coming from the neck, and those will travel into the shoulder, the arm, the hands. And same with the mid-back. You can have mid-back nerve compression, which is more rare, but does happen where it can travel into the viscera or even the chest. So I had a patient, he had heart pain on the left side, which he thought was heart pain, pain in his left chest. And he had gone through all kinds of cardiovascular workups, anything from like an angiogram. He wore EKG for a certain amount of time. He had all the heart tests that you can imagine. He went through it because he was having this chest pain, which they were trying to rule out a heart attack because he was of the age, a busy 50-year-old corporate worker and stressful life type of thing. But all tests came back clear and his heart was doing fine. So they sent him to physical therapy. So he ended up in my office saying, I have this heart pain, this chest pain, and nothing's wrong with my heart though. And I looked at his mid-back, his thoracic spine, and found a rotation in a couple of his vertebrae. Ends up he's a motorcycle rider. So is on the bike with the handlebars that are such a way where he always has to do the gas with one hand more than the other. And it's his passion and his hobby, but it manages to rotate his body where those few segments of his mid-back get kind of locked in this rotation. And it was pinching on the nerve that was radiating to his chest region. So in one session, the first session, now this kind of is misleading because, this is not normally the case where one session fixes the problem. But in this scenario, I derotated his mid-back and his chest pain went away completely. And I mean, he still talks about it to this day. And that was like over a decade ago. Wow. But he also had from biking, and he was a helicopter pilot. So they wear a lot of gear on their head. So he was also having some nerve symptoms down the arm and tingling in the hands and such that was coming from his neck that, we had to work on as well.
Yeah, so let's talk about some of the therapies that you do recommend, physical therapy and yoga, and what that kind of looks like for some of the back, the knee, what kind of things you're looking at.
So there's so much that can be done. It really just depends on the person walking through the door. So I'm never going to force yoga upon someone if they're not in the space where they're desiring to try it or open-minded to introduce it into their lives. So in that type of scenario, I start with more of the traditional physical therapy. So strengthening certain muscles, flexibility, stretches, that sort of thing, manual work, working with the soft tissue to help bring balance in any of those issues that I was talking about before. And then yoga is just another tool. It's another modality that I can add to all that type of work if someone is interested. So I have a yoga wall in my clinic where we can use for traction and space in the spine. So literally people can hang out and take pressure off their nerves, and it's very calming to the nervous system and the mind as long as they don't have a fear of being upside down. But with the yoga wall, we can also build strength and that sort of thing. But we can also get down on the mat, and I can guide them through restorative postures that are very calming the nervous system and replenishing, and a guided meditation and visualization. So a lot of the times with my stressed out moms and women with pelvic floor issues, or like, for example, for myself, my naturopath, after looking at my blood values in terms of cancer prevention, and because I'm at risk for ovarian cancer, she said, right, the best thing that I can do for myself is stress management. And that would not tax the ovaries as much. Whereas if I'm stressed out, the pattern that happens in my body is that my ovaries are working and producing more estrogen than needed. That sort of thing. So I practice this myself, like restorative positions where the body can feel safe and let go and move from the fight or flight response to the rest and digest response, where different hormones are secreted, healing happens. And then I sleep better at night because I've processed the emotions, I've processed the fears, the anxieties, and I have new hope. So I guide a lot of people through that, especially now with what's going on in the pandemic with not being able to see people in person. I'm doing a lot of sessions online, and that's primarily what I'm doing. And it's interesting because the response I'm getting is it's different. right? So a lot of times they're expecting the massage, the manual work to get that relaxation type feeling. And they're surprised to find out that my words can guide them into that type of response. They can have a similar feeling in their body of relaxation, of letting go, of being restored, or a visualization to help aid with healing or whatever, they want to visualize, that can happen over online or through a restorative posture or a guided meditation, that sort of thing.
Absolutely. Yeah. We offer fertility yoga too. And it's the restorative, the hatha, the slow, where you're like, oh, this is so slow. I actually want to, leave the room. It's so slow. Well, that's kind of where the healing is, to lean into that yin yoga where you're holding the pose for 3 and 4 minutes or longer. And you're like, wait a minute. But helping with the blood flow. And so what are things that you see people get wrong about? So you've got this, if there's chronic pain, you identify what the issue is, physical therapy, and then yoga if they're interested. What are things where people with the treatment where you see people might make some mistakes?
Overdoing. For example, back to that sciatica, which is so common, I'll give them a nerve glide or a traction stretch or something like that. And they just either do it too much or too forcefully. So that nerve really gets yanked upon and it stays flared up. Or avoiding the restorative and meditation part, thinking because they feel so busy, right? It's really hard to slow down and be still and sit with the uncomfortable thoughts, the uncomfortable feelings in our body. So a lot of times we just avoid the restorative practice. Or sometimes people have a misconception that yoga always has to be a workout, right? So there's different types of yoga for different purposes. For me, on a given day, the style of yoga that I practice really varies. Some days it's replenishing yoga to help me heal or de-stress. And yes, some days I do an active form of yoga that gets my heart rate up, or I sweat or build strength or whatever those things. But, respecting my body where it's at when I'm healing, I'm going to be obviously backing off that workout type of yoga or workouts in general, and refining and modifying. And sometimes I find that a lot of my patients, a lot of my clients have a fear of changing their program or reducing the working out type of yoga, and there's many reasons because of this. Like, I'm not saying that workout's bad. It's just overdone a lot of the times, and they're afraid to let it go because they might get fat or lose all the momentum that they created. That's often another mistake I see.
And what about with physical therapy then, not like completing the treatment plan? Are you seeing any of that?
Yeah, the type of patients that I attract, that's more on the rare side. Mm-hmm. I typically attract a lot of really committed patients, and they're paying a high price. So they want to get their money and values worth. I do attract a lot of type A, and maybe that's because, I have that type of personality myself, going. So they're the type of people that I work a lot with are the overachievers, the overdoers versus not doing.
Mm-hmm. So they're pretty compliant then. Yeah.
Yeah. And education I find is huge. Like if they know why they're doing what they're going to do, like in their home program, or why they need to make these hard changes in the yoga class, skipping chaturangas or whatever it may be. Like, especially with fertility, I find I've had a few patients that were just over exercising, and it was just too much stress on their body. And that was part of the reason why they were having trouble conceiving. And so backing off the workouts.
Absolutely. Yeah. Now's not the time to train for the marathon.
Right.
Mm. And so the lifestyle recommendations, you're looking at either yoga or meditation, visualization, doing sort of those slowing down. And I guess if you don't have time for it, that's the kind of person that actually needs to make time.
Yeah, totally. It's the hardest.
That's right.
But even 5 minutes a day, like just meditating or putting yourself in a restorative position right before bed, for example, it does make a difference, because it's that cumulative effect of doing it consistently that layers upon itself. And then you begin to crave it, because when you miss days, you notice the difference. And so then when you get that value, you get that feedback of feeling the benefits of the work, then you're more inclined to increase the length of time. So start small. Don't take on too much too quickly.
And we have our couples do start with the elimination diet to figure out diet and really how that impacts their health. And then a lot of times, obviously, diet can have inflammation and impact your joints as well for stiffness. So are you doing anything with diet with your people, or?
Yeah, in a general sense, that isn't my specialty. So sometimes if I find that it really is a key player, I'll refer out at this point. Because I'd rather have them go see someone that really specializes in helping to figure out what foods are continuing to inflame them and such. However, it is on my bucket list, a functional medicine program. So then I can, because I do work with a few patients that have Hashimoto's or other various autoimmune diseases or Lyme's disease, where just a general inflammation kind of persists in their body. And so lifestyle is huge in this type of scenario, because it really is a multifaceted, layered approach. And again, you can be too rigid. So there has to be some flexibility in the program, so someone's not getting stressed out because they're not completely 100%, compliant or trying to live the perfect life,
Exactly.
That's what I asked my naturopath when I was going through, trying to figure out my own quote unquote protocol for managing Lynch syndrome. I'm like, well, do I have to cut out all wine now and all sugars? And for me to live my life so rigidly, it would cause me more stress. So I do try to eat as clean as I can and really moderate sugar. I have really cut down sugar intake just because, of research supporting that. However, if I, have a birthday or something special, I'm not going to be so rigid at that point in time.
Okay. And then what about, are you recommending any supplements, or that's not part of your?
Again, that's loose. I work with a company where they have a whole lot of wellness supplements that I can guide someone with. So I make recommendations for that in their protocol, where I might see holes or gaps that delay healing. Because of course, especially when healing from injury, having all the nutrients and minerals and substance in the body to aid the tissues to heal is required. So if I'm seeing gaps in their nutrition, or for example, I have someone with celiac disease and someone with Crohn's disease. So scar tissue and inflammation in their colon can really impact the ability of the intestines to absorb the nutrients, right? And then they're having so much pain and inflammation in their joints because the tissues aren't getting the nutrients that's needed. So sometimes I do manual work there. And then, yes, if there's certain supplements to help aid that process, I'll recommend them.
But magnesium to help with, that's part of we have some basic supplements we recommend for fertility, and magnesium is one of them. It's also good for muscles and pain. Are you?
Yes.
Yeah.
Yeah, that minerals, I usually recommend a mineral complex, because sometimes it's like vitamin D. It can't be absorbed and efficiently do its job by itself. It has to work synergistically with these other, or calcium, for example, it needs to work synergistically with other minerals and nutrients. So usually I'll go for a grouping of supplements to help make sure that they're going to be working together.
Yeah. And what about essential oils?
Yeah. So same company I work with, that I've been to their farm in Utah a couple of times. So I like this company because they're very transparent, just because the market isn't regulated. So when you pick a bottle up in the grocery store, you just don't know what type of fillers or junk is in there. Some brands are better than others, but I like this company because they have a good variety to choose from. And they're very, very helpful with helping to calm the nervous system. So I use them a lot in my sessions, support like healing to help support the nervous system. So, and I know that they're clean, so they don't have any fillers or junk in them.
Which one is that?
Young Living.
Oh, Young Living, right. Yeah, we've got a couple podcast episodes talking about essential oils helping with fertility and hormones. So you can check those out on the podcast. And I guess lavender can be helpful too with pain.
Yeah. I make special blends that I use in the clinic. So I have like a pain blend, a relaxing blend, and then sometimes I'll just drop, if I'm really feeling that one particular oil will help someone at that time based upon, the symptoms that they walked in the door with, then I'll even just drop it into my hand and have them inhale it in the very beginning of the session. So, and I think fortunately now too, there are more awareness of quality of essential oils. So I think there's more options too.
Yeah, I love that. I have one in my office. I turned it off right now because I thought I could hear the diffuser. But today I had eucalyptus and I mixed it with orange. Oh, that's kind of nice.
Oh, that's nice.
Kept me wide awake. Okay, so what about? Is there anything you're obsessed with right now? Be it a book, a website, an app, a documentary, anything that you are digging?
Oh my goodness. I am such I'm a podcast junkie. So I listen to them in the morning when I wake up and on walks. So yeah, there's a few I'm cycling through right now, but for mindset, I've been really listening to Brooke Castillo's The Life Coach School, just because, and then also combining that with Stephen Porges' polyvagal work with the nervous system, because the two just blend. The vagus, they blend so well together. Where Stephen Porges describes, the nervous system and all that's going on when we're living in the fight or flight response time, and the lack of vagal tone, so to speak. But then Brooke Castillo, now she doesn't combine these two like I do how I do with my work, but essentially she's talking about how our thoughts affect how we feel. So it's our thoughts, our mind, that will put us into the fight or flight response or not. So if you trace it back to source, our brain, and you're really starting to pause and observe and create awareness of what's triggering you, what's the actual thoughts that, okay, so if you feel pain, what are your thoughts about that pain? Do you have fear, worry, anxiety, and then that exacerbates the pain and makes it worse, or the stress and makes it worse? Or are you confident with your program, with the work that you're doing with your practitioners, that you're like, oh, okay, I'm feeling a little something right now, but I know exactly what to do to make it feel better? Then the nervous system is going to stay down regulated. And it all goes back to the thoughts, because most of the time what's happening in our life are neutral situations, but it's how we observe or perceive those situations that can really affect what goes on internally in our body, whether we're aiding our body to be, and our organs to be most efficient in their work, or we're delaying and impacting things.
Yeah, we're labeling it as saying it's good or bad, and when it just is, and it's not, going down that rabbit hole of good or bad. And that was
exactly.
Brooke Castillo. And then Stephen, what was the other, his last name?
Porges. I might be saying that wrong, but it's Porges.
Okay, great. And is there a success story, anything you wanted to share with us? You've shared one about your fellow there with the motorcycle rider. Anything else that came to mind with hormones or fertility, if you have? Or
yeah, I had a woman so sweet, and she'd been to many other practitioners, and she was in the health industry herself, so was a personal trainer, she was a yoga teacher, so she had very good body awareness and knowledge. In fact, so much so, and had seen so many practitioners when she came to me for pelvic pain and infertility issues, that I looked at her and I'm like, my first thought was, oh my goodness, how am I going to help her? Like, what do I have to add to this, to really help to get her result? And come to find out, she was perfect picture case of overdoing. Just everything in her life was overdoing, like lists mile long, like never carving out the time to actually care for herself. She was a single mom at the time, so caring for her children, caring for her clients, go, go, go. And then feelings of unworthiness and stress and all this day after day compiled on her nervous system. And then she would work out to the max to release some of this stress and also to make herself feel worthy and feel like she did something for the day. So all this was leading to all sorts of issues in her body, chronic pain, and just an overall inflammatory response. And so what I did was just give her some simple restorative postures. My first session, even though she didn't want to do it at all, but was open-minded at that point because she had tried everything. I guided her through a visualization, and getting in touch with herself and giving herself compassion and love and all those kind of stuff that, sometimes a little icky and uncomfortable. And, for us overdoers and type A personalities to get in touch with our emotions and feel all that we're feeling and not resist it and block it. And, she came in a few sessions later and she even looked younger, like her face softened and it was more vibrant and she was experiencing more joy in her life. She hadn't realized how much she had shut herself off to joy and happiness. And so, that was truly a remarkable scenario because it was someone who walked in my door that I didn't know if I would be able to help, but I just decided to listen to her story and trust myself that the answers would come up as she, told me her story and to go with my instinct and guide her through those uncomfortable places and the work that she didn't necessarily want to do. And it did lead to very good results.
I love it. Love it. Yeah. And that resistance, if you're like, wait a minute, you don't want to go there, that's where you need to go.
Yeah.
And so I think you've got a number of different opt-ins on your website there. Is there something that you'd like to direct the listeners to as far as a free download that you have?
Sure. It just depends on, if they like a book, they're like to read, then they can download one of the free PDFs, the free guides, and if they go to the physical therapy tab, they're really segmented by body part or issue, like low back pain or sciatica, for example. If you're a visual learner or kinesthetic and like to do and feel, then I have a free mini core class and the common mistakes of core strengthening. And that's on my website under online options, free core masterclass.
And they can find your website at
igniteyourwellness.com, and the your is with a UR. So igniteyourwellness.com.
Great. Awesome. So igniteyourwellness.com. Awesome. Well, thanks for coming on and sharing some tips about chronic pain and what we can really do to address this. And it's not just all about the physical side of things. It is digging into the whole mental, emotional side of things too, which is equally as important. So thanks so much for coming on, Alison.
Yeah, thank you.
Melatonin is important for female fertility. It helps regulate hormones and maintain the body's circadian rhythms. Plus, it helps determine the frequency and duration of the menstrual cycle. Plus, it impacts sperm count and motility. Blue and green light negatively impact our melatonin production. That's why we recommend Blue Blocks, blue and green light sleep classes to all our one-to-one clients. Simply go to Blue Blocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast at checkout to receive your 15% discount. That's BlueBlocks, BLUBLOX.com, and use the coupon code GetPregnantPodcast. Hey there, I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery Call is for action takers, really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to Fab Fertile, FABfertile.com, and click on Book a Free Call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's Fab Fertile, FABfertile.com, and click on Book a Free Call. The Get Pregnant Naturally podcast, including show notes and links, provides information with respect to healthy living, nutrition, lab testing, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Get Pregnant Naturally podcast reflects the most up-to-date medical research. Information is provided without representation or warranties of any kind. Please consult a qualified physician for medical advice and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.